I'm Reverend Phil, and I'm your host for Words of the Prophets. Where are our prophets now? Where are those messages God chooses to communicate divine revelation through? In the past, the Creator has sent prophets like Abraham, Siddhartha, Jesus, Muhammad, and many more. Maybe our higher power has switched tactics since we reinterpret God's words as soon as the Creator's prophets leave us. Could it be that Spirit talks to each one of us individually and we haven't learned to listen? On Words of the Prophets, our modern prophets show us how to find the internal prophet that is the I Am, and we discuss the application of spiritual principles in all aspects of our lives. Love and light, everybody. I'm Reverend Phil, and I'm your host for Words of the Prophets. Today, we have two guests with us. On my far right is Dr. Yolanda Briscoe, who is the clinical psychologist, executive clinical director of the Santa Fe Recovery Center. Welcome. And in between us is Julie Roberts, who is the acting director of the Drug Policy Alliance, New Mexico. So it doesn't take a genius to figure out we're going to talk about substance abuse today, right? Okay. Today's prophetic topic is the transforming power of God's grace. Our topic comes from a 2004 Evangelical Lutheran Church in America document entitled Government and Politics, Lutheran Voices and Views. On page 8, in a column entitled Christian Principles in Election Year, point 9 reads as follows. Because of the transforming power of God's grace, all humans are called to be in right relationship with each other. We look for political leaders who seek a restorative, not retributive, I butchered that word, approach to the criminal justice system and the individuals within it. So before we start, two things. I want to start with a disclaimer. One is I am a recovering drug addict. You've heard me say that before. I wanted to say that again. Disclaimer number two is that I am on the board of directors of the Santa Fe Recovery Center, but that's not why Dr. B is here with us, and whatever I say reflects me and not the Santa Fe Recovery Center. I want to read a statement, then we're going to get started. Today's show is dedicated to all the men and women who are serving time in jails and prisons in this country because of an antiquated, fear-based notion that punishment, not treatment, is the only way to deal with people who are caught using and abusing drugs. My guests are here today to refute that concept. I believe in and support with all my heart and soul the concept of God's grace as made manifest through you, the viewing audience. Please take a stand for the unity that is spirituality and add your voice to those already speaking out against this barbaric, immoral practice of unnecessary incarceration. If God is patient and forgiving, how could we not be? So with that, before we even really get into the topic, let's let both of our guests just kind of introduce themselves and the program they represent. So Dr. Briscoe, do you want to tell us a little bit about you and Santa Fe Recovery Center?
Sure. I'm here from the Santa Fe Recovery Center. We've been in operation for 5 years. We took over what was formerly called RAP, Recovering Alcoholics Program, 5 years ago. We have a new administration, new board of directors. We're now fully accredited and looking at starting a supportive housing. We have several outpatient buildings now and doing really well. So I'm happy to be here.
You know, I said this on another show, so I'm going to ask you the same question because, I mean, for me, it's not a big stretch. I'm also a licensed alcohol and drug abuse counselor, just to throw that in too. But, you know, being a recovering drug addict, I kind of, you know, natural that I become a licensed alcohol and drug abuse counselor. Most of them, you know, one form or another do. How did you get into the substance dependence field? What got you there?
Well, I have to say that through my bachelor's, master's, and into my doctorate, I said I would work with any population but drug and alcohol. I had the same bias that a lot of people do, who wants to work with a bunch of drug addicts and alcoholics. It wasn't until I was working in a treatment program in San Francisco as a program director that I realized that I would be given the tremendous honor of being able to work with individuals who are in recovery, and now I can't think of doing anything else.
Okay.
Continuously humbled by the experience that individuals go through to get recovery, there's a miracle that happens every day.
Yeah, I agree. I mean, I loved what the work I was doing. You know, when I worked at the old Rap, and I don't want to get too much into my history, but you know, these are my people. You know, it's like I kind of miss it. I do my own counseling, but it's like you don't have that. The dynamic of a treatment center is different than the dynamic of a private office. Julie, tell us a little about you and the Drug Policy Alliance New Mexico.
Sure. My name's Julie Roberts. I'm Acting Director of Drug Policy Alliance New Mexico. We're a national nonprofit, and we have an office here in Santa Fe, New Mexico. We mainly work on statewide public policies that provide safe and effective alternatives to our nation's and our state's failed war on drugs. So we work on public policies that treat drug use as a public health issue rather than a criminal justice issue. So when we talk about the war on drugs, I think we need to be clear about what we're talking about. Is it really a war on alcohol, a war on marijuana, a war on heroin or cocaine? Truly what it is a war on people.
Exactly. We're going to war with our own people.
Absolutely. And, you know, we have, when we talk about drug use and we talk about drug addiction, unfortunately, we also have to talk about the criminal justice system, because that's how our country for the past few decades have dealt with drugs and drug use as a criminal issue. So something really needs to change, because criminalizing drug use and criminalizing drug addiction is not giving us the safe communities and the healthy families that we need in New Mexico.
So let's define our terms. Maybe this is a good one for you, Alonda. Define what is an alcoholic and a drug addict, clinically.
What is an alcoholic and a drug addict?
Yeah.
Well, there's different levels. You can be an alcoholic. You can abuse alcohol. Is very different from being dependent on it. And
so the alcoholic would be the dependent.
Yes.
Okay.
And
let's talk about dependence. Let's go for those two terms.
Okay, dependent, where it is no longer recreational, that the individual has to drink or use drugs to cope. It's in the forefront of their brains, and these are not the clinical. This is just the layman's, that when you're to the point where this is all you think about, you're dependent. This is everything happening in your day is centered around the alcohol or the drugs. It's very different from somebody who goes out socially. You can't be a social heroin user, but if you're a social
No,
drinker,
not really.
if you're a social drinker, you can maybe drink every now and then, special occasions, and it's not going to affect your life, your daily life.
So if I were to say substance abuse is about behavior and substance dependence is about the physical impact of the substance, would that be accurate?
That's completely accurate. Your body has been completely altered. Your brain has been altered.
So let's talk about this. Let's break this out in both segments, the body and the brain, whichever one you want to attach first. I mean, you know, how does the brain get altered? How does the body get altered?
Well, the body gets altered by the substance, the physiological need that happens. It's separate from a psychological need, where somebody wants to drink maybe because when drinking they can be social in a social atmosphere, or going to a party they feel like maybe if I have a drink then it'll loosen me up and I can have a better time. But the dependence of the physiological, if you don't drink you will go into withdrawals. Your body will seek it, will go after it, and nothing can stop it. So oftentimes people will say, well, if they really loved me, they'd quit drinking or they'd quit using drugs, but it has nothing to do with the love of someone else or willpower. It has to do with your body needs that drug, and it's going to do everything it can to get it. Or if not, it's going to let you know.
Yeah, exactly. Let me try to put in a little more clarification on this. The difference between a abuser and a dependent is an abuser, let's say they could do the same amount of substance as the dependent does. They could be just as crazy and nuts as the dependent is. And they get to a place where, let's say, all of a sudden they get a job and it says, we're going to be drug testing you. And they say, oh no, I can't afford to lose this job. And they will just stop.
Right.
The addict, the dependent, the alcoholic, and the dependent will say, I could beat that test and keep on doing what they're doing.
Right.
Yeah.
Right.
And so, I mean, I want to make this clear for the audience, because we're going to keep developing this theme, I believe, you know, for the rest of this show, is like, how do we deal with the two separate categories, you know, and Julie's statement was about this, the latter category, the dependent. We've got people who are physically addicted. We have to treat them, I believe we have to treat them differently than we have the people who have a voluntary desire to choose the substance. But I want to, just before we even get a little bit deeper into that, Doctor, could you give us a little bit of a build-up as to what would cause somebody to want to do that to themselves initially? I mean, I think they start
Well,
off
it's not like anybody ever starts out to be an addict. I know what I'll do. I'll do a little bit of cocaine and then I will totally, completely ruin my life or get completely in debt and ostracize my entire family. Those aren't the initial intentions. That's what develops after the brain has been altered. They did a study with some mice. If you don't mind, I'll give you this just analogy.
Go for it.
Because when I heard this analogy, I said, that's perfect. Mice were forced to, well, not forced, but they were made to become cocaine dependent. And one of the conditions was that they had to go into the light. Now we all know that if you go into your kitchen or you go into your room and there's a mouse in there and you turn on the light, the mouse is going to get away from the light. It's going to go to the dark because that's evolutionary, and through survival it's learned that stay away from the light. But the scientists were able to alter their behaviors to where the mice would go to the light to get the cocaine. So it's completely altering the brain mechanism and evolutionary mechanism of the little mouse. So that's the same thing. What I tell families is your loved one is kind of like that little mouse. Even though he knows that going into and using drugs is going to kill him, the brain has been altered to where that doesn't matter anymore.
And I would like to add here, too, that people use drugs for different reasons. And we do a lot of work with youth drug prevention. And one of the things that we see is some young people choose to use drugs recreationally, choose to use alcohol. Maybe it's because they're at a party, they choose to drink one beer. And then there's also young people who maybe are trying to deal with an overlying mental health issue. So maybe there's problems at home, or there's difficulty with depression or another mental illness. And so oftentimes people turn to substances to try to deal with those mental health issues because they either don't have access to health care or are scared to bring it up with their healthcare provider. So there's a range of issues, and unfortunately you just never know if your brain's hardwired for that particular addiction or not.
Well, I can't tell you how many people come into our facility that have the co-occurring disorder, and it's something as simple as depression. The big one is anxiety, because alcohol is a depressant, and so you're calm. If you're anxious, and if you had an underlying anxiety disorder, maybe a social anxiety disorder or attention deficit disorder, and you were using it to self-medicate to calm you down. And so what we try to do is teach you a new way of calming yourself without using a drug, other ways, meditation, yoga, and so forth, because individuals just don't know it. You have to teach somebody a skill, because if they could stop, they would. Who wants to be miserable? Nobody wants to be miserable. Absolutely. If you could, you would.
Well, I mean, and I don't want to get too deep into my own personal story. I used because I was miserable, and I was looking for a way to escape it. I mean, so do you find a lot of addicts, alcoholics, coming from traumatic backgrounds?
Absolutely. Whenever I do an assessment and I get to the part where it says, have you ever experienced any trauma, whether it's physical, sexual, emotional, or mental, and I'm just waiting because I'm going to, by and large, check something off. And the trauma could be something like even a trauma as a child, multiple hospitalizations. It doesn't have to be the standard physical or sexual molestation, but it can be a trauma such as early trauma, having multiple hospital stays. So there are so many different ways that somebody can be traumatized, and that's a big one.
Yeah.
And I think this really highlights how drug use and addiction truly is a health issue. And it's so, I feel like drug users and people struggling with drug addiction are so often stigmatized and demonized in our society when they're actually the people who need the most compassion and the most care, the most services, because it truly is a health issue. And we don't see hospitals or clinics turning away people with diabetes and locking up people in prison if they don't take their insulin if they're diabetic, yet we currently do that with people with drug addiction.
Well, there's so much fear. The fear is that somehow they're going to hurt me, which it does happen. Somebody driving under the influence can hurt somebody. And so I think that there's a lot of fear around, and fear around what somebody can do to you.
So we've got voluntary and involuntary. Let's use those terms for lack of better terms. How do we, as a society, distinguish between the two of them? I mean, that's one of my pet peeves. I've worked with referrals, let's say, that come through the court system, and I believe the court system's got it all backwards. So we're treating abusers like they're alcoholics, and we're treating alcoholics like they're criminals. Then we put them in jail. The jail has no therapeutic communities. And we're overkilling the ones who are not alcoholics. I mean, how do we possibly get this right?
Well, you're right. You see those big signs that say DWI, and there's going to be a blast of police officers for the next, I don't know how many days, a blast of summer. And for the individuals who aren't in recovery, for individuals who go out and maybe drink too much at a wedding or at some other, they're going to say, whoa, I better be careful. We have individuals who come to our program who have, I think the record is 21 DWIs. Average is about 3 to 4. For that individual who's truly dependent, those signs mean nothing.
And I think part of it too is offering a continuum of care for people. And I think it is a good point to acknowledge that there's different stages of drug use, and that all drug use does not equal addiction. And what we need in our society is a range of services, kind of a bucket to pick from if you're at this end of the spectrum, to make sure that maybe you need counseling, intensive outpatient treatment, versus someone who has 21 DUIs who's going to need some pretty intensive therapy, or someone with a 25-year heroin addiction who would maybe benefit from medication-assisted treatment such as methadone or buprenorphine. So I think that's part of what we need to look at as a society, is how are we going to provide a range of services for people that correspond with the range of drug use that our society sees.
Well, those range of services are available, but I think it's a matter of education, because an individual comes before a judge and they say, oh, you need treatment, go to residential. And it may not be appropriate.
Absolutely.
And those judgments are made non-clinically.
Exactly.
Absolutely.
They're made politically because, and I'm not trying to knock the judges. I mean, they got to get elected, so they don't want to let somebody out and then have somebody do something drastic and then say, well, why'd you let this guy out or this woman out?
Because if something happened, again, it's fear. It's all based on fear.
Absolutely.
We have in the United States an organization called ASAM, the American Society of Addictive Medicines, that they set the standard, and the courts don't use it. I mean, why? Do we know why?
I think part of it is a lot of the courts, the judges' hands are tied. We're very lucky that some of our communities have access to specialty courts such as homeless court, teen court, drug courts. But for those jurisdictions that don't have the funding for those drug courts, a lot of judges are not equipped to make the decisions about sending a person into a treatment center. So one of the things at Drug Policy Alliance that we've been trying to do for a number of years with Dr. Briscoe's help is to pass legislation that we've dubbed treatment instead of incarceration. And so what this legislation would do is, for the first time, give judges the discretion to consult with a behavioral health specialist, someone who does know the clinical backgrounds of addiction, who does have that knowledge, consult with them and decide what is the best option for this person. So a person could receive appropriate community-based treatment instead of a jail cell.
I mean, right now and I think it's still a standard. I haven't done any work with the agencies that I was getting some state work from. But if you blew 1.5 times legal limit, so if you were at 0.12, they wanted you treated as an alcoholic, regardless of circumstances. And that has nothing to do with the ASAM criteria. There's nothing about how much you've consumed at any one time that sets the standard. You know, and you're talking about those distinctions. ASAM has them set up. There's early intervention, outpatient, intensive outpatient, inpatient, and they tell you what the criteria are.
And they're very clear. The criteria
Yes.
is very clear. I use it on my assessment. You have to look at all kinds of factors. Their environment. Do they live alone? Something is what their age is. What are the demographic risks? What kind of supports do they have? And it's pretty clear that you have to meet all these. You have to be at a high level on all of them in order to need residential treatment. So what happens is somebody comes in before a judge, and again, they're trying to do the best they can. I'm not trying to knock judges because they want the streets to be safe. And so somebody comes up in front of them again, they say, you need to go to jail, and when you can get a job at the recovery, when you can get a bed at the recovery center, you'd probably be, it would be sooner to get a job than get a bed at the recovery center. Because we just have, we have 23 beds for a large county, and we serve the entire state. So you will wallow in jail until you can find a bed, and that's not really serving anybody. It's a disservice to the individual, to the community, to the employers who now have somebody who's out in jail and not working. So it just goes on and on. It snowballs.
And it goes, and you're hitting it right on the head. There are so few treatment centers, and you've got to beg, borrow, and steal to get people in, and pay for their 30-day treatment. And then if you go back to the ASAM criteria, it's been documented over decades that the longer somebody is under supervised, continuous care, the better the results. But we don't want to pay for 90-day treatment centers. We don't want to pay for halfway houses. We don't want to provide that continuum of care. We want to put a Band-Aid on a big wound and say, look, we did something.
And I think a good point there is that we're not willing to fund the treatment programs that we know work, but we'll build more jails, we'll build more prisons, and I can guarantee you that if you get caught for drug possession, they'll have room for you in that jail, but they definitely wouldn't spend that money to make sure there's room for you in a treatment center with a counselor or case manager. So we really need a shift in priorities here, because the money's there. I mean, we are currently paying to lock up people with drug addictions, yet we're not willing to shift those funds to programs that we know work, such as inpatient methadone treatment, buprenorphine, and programs like Dr. Briscoe's.
Well, also, what kind of programs work? Because just because somebody has a treatment facility doesn't mean that it's going to work. I have to admit that when we first opened, our criteria was, do you have a pulse rate? That was it. And we've come, in the course of working and finding out that, no, we had to be really mindful of how we were using our taxpayer dollars.
Absolutely.
That they have entrusted this center to us, and so we have to make sure that the individual coming in for treatment is meeting ASAM criteria, that the highest level of care is what they need. Otherwise, try outpatient. And if outpatient isn't working, then go to residential. But you do have to put your money where you see that it is working.
Absolutely.
So how do we change this?
This.
Okay. I'm down for that. That's why we're doing the show. I mean,
yes.
it is education. And I think it's getting past that fear. I mean, it's like you're saying, we didn't have the information we have now. So the substance abuse, the alcohol, we treat it as a criminal act because there was that concept that if you really wanted to stop, you would. So if you don't want to stop, we're gonna make you stop. But that's no longer the case. I mean, I hate to say this, but we're going to keep having more and more of these, alcohol-induced accidents. We're doing it all completely backwards. It's like herding cats. You can't do it.
Well, there's a psychological term called status quo bias, where people have a real difficult time with change. They'd rather see everybody doing the same thing, rather than doing any kind of change because it's frightening.
Well, there's a thing in 12-step program. If you do the same thing over and over again, expecting different results, that's insane. That's one of the definitions of insanity, and that's what we're doing as a society. And there's a big uproar because of what happened, 2 months ago when those 4 kids were killed. You know, and that's what we also seem to do. We overreact to certain situations. Not that that isn't a tragic situation, but you know, everybody rallies when there's a situation, but then they're looking for a quick fix.
Make more laws.
Yeah.
Enact more laws and build more prisons.
And more punishment. And I think that's part of what we try to do at Drug Policy Alliance is really tackle the problem from the education standpoint of public perception. You know, how are folks talking about the issue, thinking about the issue, as well as actual policies. So I think that's, you know, as for the education component, I think it's, you know, it's doing this, it's talking about it, it's being aware that drug addiction is a health issue and that it's not a criminal justice issue. And then I think for the policy perspective, it's also having people get involved in the political process, whether that's contacting the folks at the city council or the county commission, or, you know, joining us at the state capitol during the legislative sessions, because we're up there every session asking for more money for substance abuse treatment programs and trying to change the way that we treat drug addiction in the state, such as the treatment instead of incarceration legislation I spoke about earlier. So I think it's a kind of a dual component. But it's going to take all of us speaking together to make folks realize that this is the #1 issue that we need to deal with if we're truly going to talk about our kids, our health, public safety in our communities. It's an issue that affects all of those things.
I mean, nothing has really changed, but are you seeing shifting?
We are, especially at the national level. You know, we just saw the repeal of the Rockefeller drug laws in New York State, which were some of the most punitive drug laws this country has seen, on the books for 30 years, and they were finally repealed. And so part of what that does now is allow these nonviolent drug possession offenders to be considered for treatment. Absolutely huge. We're seeing, you know, more changes in California. In New Mexico, we have seen, you know, a number of legislators really stand up and say that this issue is important and that we do need change. Unfortunately, we're not there yet. There's still a lot of legislators who aren't on board, so even more reason for folks to get involved on the issue. But progress is happening.
I want to back up for a second. Can you define for the audience the qualifications for early intervention, outpatient, intensive outpatient, inpatient? So somebody who's listening to the show who maybe thinks they have a problem, or a loved one who has a problem, they have an idea of what they need to do to deal with this problem.
Well, if you think you have a problem, that's enough.
Oh, definitely, I know.
Give us a call, because even if you're questioning, please call us, and then we can do a screening to determine the level of care. We do those for free. You come in and we can do a screening to determine whether you are more likely to benefit from residential or outpatient, because there are individuals who, you know, I just talked to somebody a couple of weeks ago, and I won't name names, but it was my mechanic, and said, who said, you know what, I'm thinking that maybe I may be drinking too much. And if you're thinking that you're drinking too much,
you are.
You might be. Yeah, you probably are.
Normal people out there don't think about having too much to drink. Yeah, exactly.
And so if you're thinking that you may have a problem, you probably do. So give us a call, and we will do a screening to determine the level of care that you need. But you know what? Don't just go to us. Call Lifelink. Call a number of different organizations, because there are plenty of clients for everybody. We don't have to be real. This is our area and we're not going to let anybody in. If the more people that get recovery, the better. And so if we can't see you right away, or we don't have a bed, or we can't get you in, we will have referrals for you.
And I think Yolanda brings up a good point as well that I just want to touch on, is I think there is a perception that there is no treatment. Some people think that treatment doesn't work. Some people think that, oh, there's not a bed for me, so there's not, you know, so I can't get treatment. And I think what, you know, and we've talked about this earlier, is that there is a range of treatments, and it might not be a bed in a facility, but the best thing for you in your particular situation may be outpatient treatment. There really is those options available in our community.
The option of, if somebody's afraid to lose their job because they're going to be gone for 30 days. Well, try outpatient first and see if that works for you. Because a lot of people get clean and sober, going to outpatient meetings, going to 12-step meetings. A lot of people who never even have been to residential, so it's not for everybody. So just because we don't have a bed doesn't mean you can't get help.
And I would like to bring up a specific type of treatment that we haven't talked about yet, which is medication-assisted treatment. And so that is kind of a technical way of saying it's when we were talking about the physiological addiction. So with replacement therapies, for probably the most well-known is for people with heroin addictions. So then they can get prescribed methadone, and then there's a new drug now that's called buprenorphine or Suboxone. So these folks, it's a replacement drug that helps them deal with those physical cravings, so they don't feel like they're craving heroin all the time, and it helps them reach a level platform so they can get into, receive counseling and the case management and more effectively finish their treatment, and while also dealing with that addiction. And I believe there's a new drug out for alcohol as well, naltrexone?
Yes. We have our psychiatrist on our staff, and we paid for her to be certified, and so she will prescribe Suboxone. What we saw were individuals coming in with an opiate addiction, not just heroin, but prescription drugs, coming in and just couldn't get past the detox. So if you can't get past detox, how are you going to even be able to get engaged into the residential program? So with the Suboxone, it has made a huge difference to where somebody can actually get through detox and then be able to be engaged in the 30-day program.
Awesome.
And so it's made a big difference.
Let's go back on something we were talking about, what you just triggered. The detox is getting the chemical physically out of the body. So in theory, if I am drug-free, I should never relapse. But that's not the case, because what happens is we have reactions that are programmed into our brain that all of a sudden something happens, and it's like, what do? Let's go get loaded. You know, so I mean, it's more than just the physical. Once that's gone, and 3 to 14 days, depending on the drug, you've got it out of your system pretty much. So now we're talking about dealing with the issues that really were behind that.
Or looking at what Julie was saying, was there an underlying mental health issue that wasn't treated?
Yeah.
Was there a PTSD or an anxiety disorder or something, or maybe bipolar disorder that somebody didn't realize that they had? So we do a real careful assessment because we want to know what the person looks like drug-free before we can make an assessment. And the beautiful thing about being in treatment and 30 days, you can actually see the behaviors. So somebody can come maybe into counseling or outpatient and say, oh, I'm doing great, everything's fine. But when they're there in vitro and you actually get to see, well, no, you're really kind of bouncing off the walls there. So we might want to look at that.
And I think a good point too is that relapse is often part of recovery, and that it takes people many, many times to deal with an addiction. And often that when that person, that initial relapse, it's so hard, and they feel like they let everyone down, but then that's when we really need to embrace them and say, okay, let's try this again. Instead of just saying, okay, maybe for somebody on probation and parole, if they have a urine test and they relapsed and they test positive, instead of helping that person get into the services and really treat that addiction at that moment of relapse, we throw them back in prison. And so I think that's something important to consider, is that people do relapse. I was addicted to probably the worst substance out there, nicotine. And it took me years and probably 4 times to finally quit. And I've been clean almost 2 years. But it took a really long time. And I couldn't have done it without the substitution therapy, without replacing it with the patches. And I did the gum and I tried the cold turkey. But I mean, it was hard. It was hard. And that was just cigarettes. So
No, that's, I mean,
nicotine is right up there with heroin.
Oh yeah,
it
oh
is.
yeah.
It is one of those legal drugs that we allow to be pushed on society. I'm not going to go there today.
That's a whole other
It's another show, really. Yes, definitely. Let's again. I keep using the word. Let's back this up. But I mean, for me, it's real important. There's a concept, and I come from a different perspective, and I look at stuff from a spiritual perspective more so than a clinical perspective, even though I have a clinical license. This concept that relapse triggers. How would you react to the statement if I said relapse triggers are valid for abusers but not dependents? If you want me to explain that.
Say more.
Being an addict, being an alcoholic, it's not what causes me to engage in my substance. It's why am I not using? When I got clean, it wasn't about what was going to trigger me to use. Waking up in the morning and taking my first breath was enough for me to use. Mm-hmm. The sun was shining. It was enough for me to use. Nothing like getting up at 4:30 in the morning and hear the birds chirping. You can't deal with that gaiety. You know? It was about what am I doing so I don't use. And it was about working a program. And I think that that's where we have built into the system, we don't even fully understand clinically the distinctions between the abuser and the dependent. An abuser, why are you getting drunk is a valid question. What will trigger you to get drunk? An addict or an alcoholic, it's about why are you not getting drunk today? What are you doing today that's keeping you sober? What are you doing today that's keeping you clean if you're an addict and the terminology?
I've heard once that you ask what were your triggers before you used, because afterwards it's waking up in the morning. Mm-hmm. I get what you're saying. Okay.
Yeah, I mean, if you're an addict, it's a natural state of being to use. So I mean,
that was it.
You're talking about relapse. It's about really having to get into a program. And when I say a program, to me, it's not even just about inpatient or outpatient, any kind of program that will give you a set of tools that helps you not give in to that desire to use. And it's not about, you have much experience hearing from people like they relapsed because they were happy. I mean, that's a very common thing if you go to 12-step rooms. People relapse because they're happy. They don't know how to deal with their happiness. It's not like, oh God, my mother died, or I lost my job, or my wife just left me.
Or right before they get a chip.
Yeah.
Because they were happy.
Exactly. Right after they got it, they want to go out and celebrate,
Mm-hmm.
But it's a whole different mindset. And for me, it's real important. And I'm not sure beyond the show what more I could do with it, but it's about, we got people making decisions like you're talking about that I believe don't have a clue as to what they mean well, but they're uninformed. It's that health issue versus the recreational issue. I'm going to stop preaching. I'm going to take a break here for a second. I got to make an announcement for Unity Church. Then we'll come back. We're going to talk about Recovery Month, Recovery Week, and all the fun stuff that's going to be happening. This thing's huge. Unity Santa Fe has all kinds of good stuff going on. So they have a interfaith workshop and dialogue, which is 45 minutes about learning about a particular faith and 45 minutes of prayer and meditation in that faith practice. And this is going to be going on from 6 to 8:30 nightly, and it's part of, they got September 1st, 2nd, 8th, and 9th. Call these folks. There's a lot of really great stuff going on there. It's Unity Santa Fe. They're off of the relief route, 599. Their number is 989-4433. They also have on Wednesday, September 9th, until it's almost a 24-hour deal. Reach in, reach out. We can change the world. It's Unity World Day of Prayer. So contact them. Ask for ask for Reverend Brendan Batchelor. Ask for anybody who picks up the phone, and let them tell you about these events. But you want to, if you want to get a little bit of understanding about some different faiths, there's Unitarian, Lakota, Catholic, and Sufi that they're going to cover on 4 different nights. Okay, that's our public service announcement. Now let's do another public service announcement. When we talk about this disease, the American Medical Association acknowledges alcoholism and drug addiction as a disease. I find it comical that one branch of the federal government acknowledges that as a disease because you can get disability benefits after, I think it's 90 days of a continuous recovery, that the other part of it will put you in jail for doing it. We have National Alcohol and Drug Addiction Recovery Month starting September. That's why I asked both of you to be on. This is going to start airing on September 1st. And then we're going to have Santa Fe Substance Dependence Recovery Week down on the plaza on September 19th. So you want to talk about that a little bit?
September 19th from 10 to 4. We will be there, Julie will be there, and everybody else in the recovery field will be there at the plaza.
It's a
free entertainment.
Yeah, it's such a great event. We've gone down and had a booth with materials for years now, and it's just such a great feeling of community, such a great sense of, you know, really coming together for an issue to make positive change in Santa Fe. And there's awesome music, there's awesome speakers. I've had a great time every year that I've gone.
Santa Fe Recovery Center hosts it, and we invite all the area providers. And the mayor has issued a proclamation, and so has the governor. I just saw that today in my email. And proclamation making it Recovery Month, and either themselves or a representative, Mayor Koss is typically there, will come out and issue that proclamation in person to just celebrate and make it aware, and again, more education. So please come on out and learn from anybody who's there, ask questions. That's what everybody's there for. If you have any kind of questions about recovery or wondering whether you have a problem, that would be the time to go out there in a very fun setting and celebratory setting.
And then DPA will be there as well if folks are interested in getting involved in more of the advocacy and really wanting to take action to change these policies and change the way that we think about drugs and drug use.
And I'm involved with this, so I could talk about this. Any agency, in social agency, any issue agency that is touched by substance abuse or dependence is going to be partaking in there, so that people are going to help you deal with the problem, help you deal with the underlying problem, help you deal with the aftermath of the problems. I mean, we're going to have people like from the homeless shelter, we're going to have people from the domestic violence, we're going to have people from rape crisis, youth shelter, all of these people, there's services out there. And
so again, we're not territorial.
Yeah.
Everybody's invited because it helps the whole community, and everybody.
Thing.
We're all connected.
Maybe you could speak. Can you touch on the numbers? I mean, how many people we estimate are in Santa Fe County who have a problem with drugs or alcohol, and how many people that translates into in terms of family members that get touched by that one person?
I don't know numbers specifically for Santa Fe County, but I know statewide it's estimated that there are over 40,000 people in the entire state who need but are not receiving substance abuse treatment. Approximately 6,000 to 10,000 people, it varies from year to year, actually do receive substance abuse treatment in the state. And so we're talking about, 40,000 people who need it but aren't getting it. It's a real serious problem. And then what was the second part of the question?
Just how many other people are touched by that? So there's family members, there's victims, there's...
Oh, it has to be countless.
From the employer to the family, the children, the stepchildren, the domestic violence, homelessness.
Yeah.
It just affects all walks of life.
And I think that's, it's a really good point to keep in mind, especially when we talk about the criminalization of drug use, is that when we send someone to prison and when we send someone to jail, it's very rarely just one person. It's their kids, it's their families, it's losing their job, losing their house, losing their health insurance. It's a whole range of issues. It's not just one person.
And the ripple effect. So if you're not out there working, you're not out there buying.
Absolutely.
The ripple effect, again, with these 4 kids, unfortunately, they were part of a school. I don't know how many kids go to that school, but everybody at that school had to be, especially if there was, in their class, so to speak, that were juniors or seniors or whatever they were, and the parents, and, it just spreads out. So it's more than just
economic. It's more than
Yeah,
that.
and it's more than just one person, just, we put them away and that's it. There's going to be somebody behind them. We need to deal with this. I mean, for me, this is the underlying, like you mentioned. I mean, domestic violence happens behind alcohol. It's the homelessness behind the drugs and the alcohol. Sometimes they go hand in hand. How do I deal with my homelessness? I get loaded.
Hospital visits.
Yeah,
That's
exactly.
another huge area.
And then another thing too, when talking about the ripple effect, is one of the things that we see, particularly with our women here in New Mexico, is that the majority of our female prisoners are in for a drug-related offense. So the majority of the women who we currently incarcerate are struggling with some form of drug abuse or drug addiction. And so most of those women also have children. And so I forget the exact statistic, but there's a direct correlation between children of incarcerated parents and the likelihood of those children going on and also struggling with addiction or incarceration or involvement with the criminal justice system. And we have to step in and break that cycle.
Well, how can you attach to somebody who's in prison?
Exactly.
Yeah,
And we're talking trauma again, going back to the,
exactly.
it doesn't have to be physical or sexual abuse, or in a sense, it's emotional abuse. It's abandonment, it's neglect. Child is growing up and saying, something's wrong here. I'm not, I'm not okay. I don't know how to get okay because there's nobody to guide them.
But if they want to be with their kids, then why don't they just stop drinking?
Yeah.
That's what you'll hear.
Yeah, exactly. And we got to do some more education somehow. We got a few minutes before we do again to the wrap-ups. I understand because of the accident with these children, there's a joint city-county task force going on.
Yes.
How's that going?
Are you a part of that?
I'm not.
No. I'm just a bystander, and so I've offered my services to give a say as far as for treatment, because the first meeting, it was all heavy into punishment and laws and enforcement and very little on treatment, but that's changing.
And I'm not familiar with that specific task force, but I do hope, as folks move forward, as hurt and as angry as we all feel, and as hard as it is to, really think clearly about addiction with problems that affect the community and make us feel unsafe, that we have to, our country has some of the most draconian and egregious drug laws the world has seen. And do we feel safer? Or do our communities feel safer? Are our communities safer? Do our children have less access to these substances? No. Our communities do not feel safe, and oftentimes our communities are not safe. Our children still have access to drugs. We need to rethink the strategies. We've been doing this for, since the 1970s, and we're not getting the results that we need. It's time for something different, it's time for something smart, and it's time for something that really deals with the issue for what it is, which is a health issue. We can enact these punitive policies, we can try to lock everybody up, and it's still not going to make our community safer, and it's still not going to decrease the level of drugs in our communities. So we really need to focus on some alternative strategies here.
Well, when you take the parents and lock them in jail because of these offenses, you're creating the next generation of the kids you leave behind. The resentments to authority, the feelings of inadequacy, all the stuff that comes from this.
It just perpetuates.
Yeah, exactly. So it's self-defeating.
And it also afflicts primarily either women and, of course, minorities are the most affected.
Yeah.
And so how do you break this cycle? But I'm optimistic that the City Council and the County Commissioners have joined together and want to do something different, have included judges and the police department, and are trying to say, well, let's do something different maybe in our little city.
And Yolanda brings up a good point with race that we haven't talked about yet, but it certainly is true that the number of people who are arrested and incarcerated are disproportionately people of color. It's true in New Mexico, and it's true across the country. And so even though rates of use of drug use are the same among, or even higher among white people. And so it's something that we need to keep in mind as well, is that we need culturally sensitive substance abuse treatment that takes into consideration, different religious practices, different ethnicities, different beliefs. It's very important.
I agree. We're going to be running down on time, so let's start with giving out some contact information.
Santa
Dr.
Fe
B.
Recovery Center, 4100 Lucia Lane. We're off of Airport, the McDonald's is. And our number is 471-4985. You can also go on our website at www.sfrecovery.org. It's in the process of being revamped, so keep tuned. Check it periodically, and again, 471-4985, and there'll be somebody there who can direct your call.
And they could reach you if they want to have specific questions, or they want to
Sure.
volunteer or get involved.
Yes. You can call me or call our intake coordinator, is Lorinda Salazar.
Except when she's doing the camera work like she's doing today.
And, but anybody there can help you or direct you, depending on your question.
Okay. And
Julie Roberts, Drug Policy Alliance, New Mexico. Our phone number at the office is 983-3277, and you can visit our website for more information on the specific policies I referenced. The treatment instead of incarceration bill we'll be working on in January, and you can get more information on that at improvenewmexico.org, New Mexico all spelled out. And then I'd also encourage folks to go to a website called reformconference.org, and that's for the upcoming International Drug Policy Reform Conference that is put on by DPA and a number of co-hosts every 2 years, and it's coming to Albuquerque this year. It's been held all over the country, and now it's going to be in our backyard. So it's a great way for folks to get really engaged in the issue, learn about the issue, and meet other people who are working on the topic across the globe.
Well, that's big.
Yeah.
It is November 12th through the 14th in Albuquerque.
And something a little smaller, maybe a little bit more pleasurable, September 19th, from 10 a.m. to 4 p.m. on the plaza. It's where you'll meet the folks in your community who are there to help you, and based upon what we're seeing, based upon the waiting list for beds, based upon what's the number of people in jail, there's a lot of help that's needed here. So don't be shy. Come on down. We'll have some snacks for you. We will have lots of music.
You'll have us.
And you get to meet I'll even be there. So if you're going to be nice to me, come over and greet me. If you got nasty things to say, take it up with my agent. That's Yolanda. No, really. We'll all be there and be happy to talk to you, whether you like what you're hearing or not. But try to come with an open mind. Want to invite all of you, if you have any questions, you want to contact me. My contact information rolls at the end of the show. It's on the screen. You have a phone number, an email, and a website. I am a minister. I am a state licensed alcohol drug abuse counselor, and I do spiritual counseling. If you think what you've heard that maybe I could help you, my services are on a donation basis, and be happy to work with you. Also, just to let you know, and the next week's guest is going to be Allison Martinez. She is going to be representing the South Side Quaker community and tell us about Quaker, about Allison, and about Southside Quaker and what is going on with them, because they are a fascinating belief structure, and I think you'll be real interested in hearing them. So, we still got a few minutes left. Parting thoughts. Each one get a chance.
Well, thank you very much for having us here. Again, this education and getting the word out is what's the most important. It's not that people are stupid by any means of the imagination, just ignorant. They want to help, have good intentions. The judges, the probation officers have good intentions. It's just getting the word out that maybe we do need to do things a little differently and forget about that status quo bias.
Yeah, we need the whole
get
new
past
mind
it.
shift.
Exactly.
Yeah.
Whole new mind. And one of compassion and care and love, and knowing that we're all connected, and you help your fellow man or woman or child, that it's going to end up helping all of us.
And I would just like to say that, it really encourage folks to get involved, and that this is a topic that affects all of us. I think everyone probably knows someone who's struggled with addiction or someone who's been involved in the criminal justice system. Recent reports say that 1 in 100 people in the United States are behind bars, and 1 in 35 people in the United States are under some form of supervision. So whether that's probation or parole, 1 in 35. We have to make a change. And part of that change is starting with changing the way that we see drugs and drug use. We cannot continue to criminalize drug use. We cannot continue to criminalize people with drug addiction. The science is there. The research is there. We know that this is a public health issue. We know what works with substance abuse treatment. And we know that jail and prison is not solving our problems. In 2007 alone, we wasted $22 million just in New Mexico to lock up nonviolent drug possession offenders. That's not drug trafficking, that's not meth manufacturers, that's just drug possession. Just people who have drugs on their person because they're struggling with addiction. So something needs to change. If not for the economy, then for, it's the right thing to do.
That's $20 million more than we need to keep in operation.
Absolutely, absolutely. So we know what works, and it's time for all of us who've been affected by this issue and all of you out there to get involved and make sure that our lawmakers know, and they know where we want our money to go, because it's our money who's paying to lock up these people.
With no success.
With no success, with no treatment. And then they're coming back to our communities. 95% of people in prison and jail will come out. 95%.
And start off right where they left off.
Exactly.
Absolutely.
Because the problem wasn't solved, the issues weren't addressed, they weren't given the treatment, and so come right back to doing what they were doing before they got
Absolutely.
it.
And we know what works, so come join us at DPA and join us for a fight for treatment, not incarceration, and ending the criminalization of drug use.
Amen to that. Thank you both.
Thank you.
Thank you.
I just want to end with, one of the things that there's a statement, once an alcoholic, always an alcoholic, once a drug addict, always a drug addict. It's one of the reasons I'm open about my history on this show. I'll never talk about what I did or how, that kind of stuff, but I used practically every day for 26 years. I have just recently celebrated 22 years of no mood or mind-altering substances other than sugar and caffeine in my body. We can change. We are, divine beings. We are children of the Creator. And, we can't write anybody off. We talked about this last week's show as well. We can't have a disposable society. We can't have parts of our society that we're just going to throw away and pretend they don't exist and pretend that nothing can be done with them. We are all equal. So it's not because I was the baddest or the biggest. It's if I could change, anybody can change, because we're all children of God. We're all one. And that is what this is about. And that's why, I thank you both. You do such great work. And again, this show is committed, this show is me, is committed to change, to eradication. If I can do this, and I could, whether you like my politics, whether you like my spirituality, if I could change my life, so can anybody else if given the chance. So let's give everybody a chance. They all deserve it. Thank you. Talk to you next week. Blessings. I'm Reverend Phil, and I've been your host for Words of the Prophets. Thank you for tuning in. Please join me again next week, same time, same channel, for more Words of the Prophets.